Have you ever noticed that your legs are becoming bow-shaped or there is a gap between your knees while standing or walking? Many people think this is simple because of aging, but in reality it is often a sign of progressive knee arthritis. Hi, I am Dr. Himanshu Tyagi, Head of Orthopedics at Fortis Hospital, Delhi NCR, and today we will be talking about this condition which is medically known as Genu Varum. In this condition, knees they move outward and do not touch each other while the ankles they remain together. It looks like the English alphabet O, the letter O in English language. So let's talk about why this happens. A simple explanation for this is our knee joint has two compartments. One is the inner compartment which is known as medial compartment and one outer compartment which is known as the lateral compartment. In most patients with knee arthritis, the inner compartment it wears out first. That means the cartilage becomes thinner and eventually it gets completely worn away. Also the cushion which is known as the meniscus of the inner side it decreases in thickness until it totally collapses and the bones of the knee joint they start rubbing against each other. Now, on the contrary, the outer side of the knee, that is known as the lateral compartment, it remains relatively preserved. This imbalance between the medial and the lateral compartment tends to give the appearance of this English letter O between our legs. That means the knees, they start moving outward and the ankles, they start coming towards each other. It is actually a vicious cycle. When the body weight increases, the transmission also happens more towards the inner side of the knee, that is the medial compartment. More weight leads to further cartilage damage, and this cartilage damage leads to more bowing. More bowing causes more arthritis, and more arthritis causes more bowing. So this becomes a vicious cycle. Now, over a period of time, when this goes on increasing, pain while walking goes on increasing. Patient may find it difficult to climb stairs, may find it difficult to get up from a chair. Sometimes there is stiffness in the knee while walking, sometimes there is increased swelling. The walking distance over a period of time goes on decreasing. Like earlier, if you are able to walk for say 30 minutes, now you will be able to walk for 15 minutes. Slowly it will come down to 5 minutes. And also the feeling that the legs have become crooked or like English alphabet O. Slowly limp will appear. And then the activities of daily living will become difficult. This happens to all of us with increasing age, but it is more common in people who are obese or fat. Also more common in people with history of osteoarthritis, or sometimes even a previous knee fracture can also precipitate this. One way is to keep your knee strength good. That means to do regular exercises to increase the strength of your knees. This will reduce the pain to some extent. Also, if you are able to reduce your body weight, that will also reduce the stress on the knees. However, the deformity part cannot be significantly reversed. So if you want to prevent it, maintain a good ideal weight from your early 30s. Stay physically active, do exercises, strengthen your quadriceps and hamstring muscles. If at all the pain starts, visit a doctor, see what you can do. Sometimes it becomes a concern, especially in situations where the deformity has increased a lot, or there is persistent pain while walking, or it is limiting your daily activities. Then of course you should definitely see an orthopedic surgeon who will get your X-ray done to understand how much the deformity is and what is the extent of arthritis. Normally, arthritis can be simply classified into mild grade, moderate grade, or severe grade. So depending on the grade of your arthritis and your deformity, the doctor might suggest you lifestyle modification like weight reduction, physiotherapy, or few medicines that help in regenerating the cartilage of the knee. However, in cases where advanced osteoarthritis is there, which we call as severe arthritis or grade 4 arthritis, then knee replacement surgery might be required to restore your body alignment as well as quality of life. So bow legs in knee arthritis in advanced stage is not merely a cosmetic issue. Normally it is a sign that the inner side of your knee has worn out significantly. Early treatment weight reduction can help. However, in advanced stages, knee replacement surgery can restore both the alignment as well as your quality of life. All the best.